Doctor, is it true that coronavirus can spread through air and one must wear mask while stepping out? Apart from washing hands, what are other precautions one can take to stay safe from coronavirus infection?
See, the transmission is mainly dependent on two types. One is droplet transmission and the other is contact transmission. So whenever somebody is coming in contact with an affected person and that person is coughing out or sneezing out, there are a number of macro and micro droplets which are spreading from that affected person. And if you are within 1 meter or 3 feet of that affected person, then there is a high chance that you will be acquiring the disease through airborne droplet transmission. So this is as far as droplet transmission is concerned. And next is contact transmission. Now these droplets are heavier in size, so they will gradually settle down on surfaces, and somebody if comes in contact with those particular surfaces by touching them and then inadvertently touching their nose or mouth or eyes, then there remains a chance of contracting the virus. So these are mainly the two modes of transmission. One is droplet transmission, another is contact transmission. So one has to be very careful, and that is the reason why to avoid droplet transmission we always say that you should wear a mask whenever you are going out of your house, or if you are in your workplace also, then you should wear a mask. So mask is going to protect you in two ways. One, if you are coming in close contact, which we always will try to avoid at this point of time, social distancing should be respected, so we should not be coming too close to each other. We should try and maintain a distance of about 3 feet or 1 meter from each other. But still, if we unknowingly come close to a person which may who may be an asymptomatic carrier or who is carrying the virus, then the mask which you are wearing is definitely going to give you a protection from those droplets. Second is that by wearing a mask, you are protecting yourself, because even if you unknowingly touch your mouth, then the mask is going to give you a barrier cover. So in these two ways the mask is definitely going to help you out. And a normal surgical mask, which we call as a 3-layer mask, is good enough. You don't have to wear an N95 mask, which is mainly for healthcare workers who are dealing with these kind of patients. A normal mask, a 3-layer surgical mask, is good enough whenever you are going outside your home. Hand washing is definitely a very important step, because as I told you, it cuts that contact transmission route, because the droplets which are lying down on those surfaces, and you are touching those surfaces, and then you are touching your face or your mouth or your nose or your eyes with your hands, and by that way you are going to contract the disease. So frequent hand washing with soap and water is definitely going to help you out, because it's going to wash out those droplets which were there on those surfaces. So this is one. Apart from soap and water, you can also use alcohol based hand rubs, so which are also quite good. And apart from this, social distancing is very important. You should be very careful of not coming in close contact with persons, because at this point of time you don't know who is carrying the disease and who is not. So maintaining a certain distance of about 1 meter or 3 feet from a person is very important. Social distancing is important. And please respect the lockdown. Stay at home. Do not come out until and unless it is absolutely necessary for you to do some outdoor activities. Apart from that, please stay at home, so that this isolation is going to break the chain. It is going to flatten the epidemiological curve, so that it's going to help all of us in the near future.